Today we embark on this journey through facts and figures that underscore the imperative of preparing our healthcare workforce for a digital tomorrow. From the burgeoning telemedicine landscape to the government's visionary initiatives, we'll explore how technology is reshaping the very fabric of healthcare delivery. Without further ado, let me start with this dynamic discussion with our esteemed panelists, which include Professor Lavanya Nandan. Professor, please join us on the stage. She has been presented with the Best Teacher Award from Parental Institution. She has more than 20 research publications and guided above 50 postgraduate students. She has undertaken the project of maternal and child health with multi-country midwifery initiative under Mamta Health Institute. We welcome you, ma'am. Please put your hands together. Next, we have Dr. Raminder Kalra. Dr. Kalra is Master Trainer for HIV/AIDS, Elderly Care and Palliative Care. She has also been awarded President's Gold Medal for Excellence in Master of Nursing. We welcome you, ma'am. Please put your hands together for all our panelists as they come forward. Next, we have Dr. Hara Prasad Mishra. He is a pharmaceutical physician at the University of Delhi. He has worked on various projects involving AI and ML in healthcare with the Government of India, MNCs and health tech startups over the last 5 years in various capacities. We welcome you, sir. Next is Ms. Merlin Gayathri. She is an accomplished healthcare professional with a wealth of experience in various accreditation audits and a strong background in nursing and healthcare management. We welcome you, ma'am. And lastly, our tech savvy, Mr. Sachin Gaur, Director Operations, InnovatioCuris. Please join us, sir. I welcome all our panelists and let this enlightening session begin.
Good afternoon and namaste to each one of you. Hopefully you're okay to sit after lunch. We will not bore you. We have 4 experts as the anchor has introduced. We have 2 experts from nursing, education and clinical practice, 1 from technology itself, and Mr. Hara Prasad is a physician, Dr. Hara Prasad. So dear esteemed guests, distinguished panelists and respected participants, I welcome all of you to this pivotal panel discussion, which is centered around the theme, Preparing Indian Healthcare Professionals for Digital Health Services. Today, we converge with a shared purpose to delve into the profound impact of digital advancement within the healthcare domain. The integration of technology into healthcare practices stands as a transformative force, redefining the roles and potentials of healthcare professionals in our dynamic landscape. Our esteemed panel comprises luminaries and trailblazers, as I said before, each bringing a wealth of experience and expertise in healthcare, technology, and education. Their insights and perspectives promise to illuminate pathways towards empowering our healthcare professionals with the necessary skills and knowledge to navigate and excel in this digital era. Let me go forward with our first panelist, Ms. Merlin. Ms. Merlin, you're working as a clinical specialist at you're working as a manager at Fortis operations. You must have come out with a lot of examples of this using technology in the patient-centric care, diagnostics, and treatment. So if you can share with all these youngsters, there are many nursing students, paramedics, technology students here, IT students, that how this can be utilized at the clinical side, clinical practice. If you have any case scenarios and also examples, I wish you to throw light on this. Thank you.
Thank you, ma'am. And good afternoon to all of you sitting here. So the first question is on how well it is for patient-centric care. So to begin with, I would like to tell you that why, first of all, digital technology should come into healthcare. We are all doing well. Everything is going on well. All of them are getting care. Why should we have it here? So there are statistics says that only 27% of our population stays in urban population, whereas around 73 are in rural side, where the same care what is expected to be delivered to rural population is not delivered to, urban is not delivered to rural. So to take it to them, to take it to each one of them, actually digital health will help us. So that's what we have been hearing since yesterday, and today also they were telling how to take it to the grassroots level people. Even a toll-free number helps that to reach them. So this is the importance of digital health at present in healthcare situation. So for, as ma'am was telling, in which way you can give me some live examples. So I can take this into 5 different parts. The first one is actually big data, which is coming up because of digital health, what we are going to. And this big data is what we are getting. For example, it's a EMR. I think all of you know the electronic medical records. With this, we are able to get lots of data, which is helping us to improve the quality of the healthcare which we are delivering. So the patient safety is the concept of the whole healthcare itself. So the data which we are deriving is helping us to make big difference and make lots of changes in the patient safety concept itself. And the second thing is about the virtual reality teaching. So what we talk about simulation training, and 2 important case scenario which we have gone through is through medicine. They came up with, they are very active in LinkedIn, you can just go and check on. They are more focusing on paramedicals. So they give lots of case scenarios for the nursing students. You just have to wear your headgear, and you can even insert an IV cannulation for a patient itself. So this helps. First of all, it is exciting. When you wear a headgear and start doing it, students are becoming very engaging in doing the simulation training. Also, it is helping us to take it forward as well. And the third thing is about the AI, that is for risk identification. AI, everybody talks about different case scenarios, but in nursing, during the initial assessment itself, we have lots of risk scoring. For example, a patient comes, I want to know whether the patient is prone for fall. So we usually use Moore's fall risk assessment tool. So just by using the AI, I will know whether the patient is vulnerable or not vulnerable. And for skin integrity, we use Braden scale assessment scale. So with that, we'll be able to find out. So for risk identification, this is very helpful. The other 2, it's mostly for medical, like diagnosis and treatment, where we are not more of it, but this particular 3 things, it's basically for nursing. So these are some of the examples which I can give about.
Thank you so much. Thank you, Merlin. What you're practicing, what I was relating with the education, what we have right now, whether it's a medical or a nursing or a paramedical, do we have this kind of, reality, what we are seeing today? Is it really contributed to our curriculum? That is one thing we have to all check. With this note, thank you, Merlin, for that answer. I'll go with the expert in nursing education, Dr. Raminder Kalra. Ma'am, I feel, as Merlin was saying, that technology has taken over the place at the bedside, clinical practice. So somewhere what we have learned that human touch is something so important, like no one can replace human touch. So how do we really balance this? Because technology at one side, we're talking that in next later 5 years, there's a lot of technology advances come at the bedside and the care of the patients. And at the same time, we are all talking about human touch. There should be empathetic, situation should be created for the patient when we are really looking into the patient outcome. So can you make them understand that that is also an imperative for the clinical setting? Thank you.
Thank you, Lavanya. And when we talk about human touch, when we talk about advancement, digital health, and all those things, nothing can substitute the human touch. Nothing can substitute the smile with which a healthcare professional goes and talks to the patient. Nothing can substitute, the empathy which we can have. Excuse me. Merlin talked about that giving you can practice giving an ID injection by using AI. But we need to remember there are individual differences. Fine? By simulation, you're not going to get that. At the same time, to get into nursing education, we always make it that we make them to practice, we teach them theory, we make them to practice in our labs. Now we have simulation labs being done. We are all embracing that digi-health into us, into our profession, into our teaching. But at the same time, they also after that go to the patients. They cannot give an ID without experiencing what is the patient's reaction. In nursing, when we are teaching, we are always talking about the first thing that we write in a nursing.
Advanced country when it comes to healthcare. They are very less digital. So Germans they don't want digitization for whatever cultural reasons. So the application somebody has built and that has got the first prize in whole of Germany was very simple. So we have all seen this scenario. So we go to a hospital and normally we have a problem, we press a button and then somebody will come to us and then we'll tell what we need. And then they will make another trip. So they said instead of this button, we'll tell nurse what exactly we need. So she can save one trip. So this is just a very simple example of an unmet need, which may be reflected from the patient or from a hospital efficiency perspective, that why to waste time of nurse. I remember a couple of years ago, we built a company which monitors the traffic of Delhi today. So we process around 1 billion vehicles in Delhi every year. Now, when we were building this technology, I think 2019, we had built it in this conference in InnoHEALTH. So anybody would have come to the conference, automatically they will get all their photos in an email. So they don't have to look at, because a lot of photos are being clicked here. Nobody wants to see, other people's photos. They want to see their own. So we did this in 2019 because we were building this technology for monitoring the traffic. So the owner of Yashoda, who was here yesterday, she remembered that example. And what was her top problem, and this is pre-COVID, right? She said, Sachin, can you build this thing for me that when I'm in the hospital, I could know who has come and who has not. So it boiled down to her as an attendance problem. And I was fully convinced because we built this attendance system in our office. Everybody's attendance was not, we were using a biometric. So we said, okay, we will check it because we want to develop this solution. So let's build it on our own, right? So we built our attendance system based on facial recognition. And then, facial recognition has gone into controversy, so nobody wants a facial recognition system today. But back in those days, pre-COVID, we built it. And then we realized in COVID, all the hospitals wanted us to give this kind of a system, which we didn't. But I realized that a good problem statement could be that if I am at a nursing station, what are the kind of queries? Doctor Saab kab aayenge? Because most of the relatives of a patient, they will go to the nursing station and say, Doctor Saab ne kya bola hai, kya bataya hai? And these are the kind of queries they are getting. And then you see they are calling up, Doctor Saab kahan pe? Acha, teesre floor pe gaye hain. Could I have built a solution which could index the way I'm saying, not faces for attendance, but helping nurses to efficiently find the information that they have been asked for. So I think I can, look at it this way, that biggest opportunity we have, if I have to conclude myself, is two things. One is that nurses are at the forefront, not just at the patient care, but also administrating care, right? So when they are administrating care, they are creating, they have an opportunity to create data, right? So I think the future nurse has to be very, very much data literate, right? And if she creates the best quality data, we will have a good quality AI system developed. If that data is bad quality, it's going to be bad quality AI. So I think there will be new kind of roles. Maybe, it doesn't have to be called a nurse anymore. Maybe you can call that person as a data officer or things like that. So I think that's a one big thing. The other thing I would like to say is that, a couple of years ago, we went to Sweden. And we realized that almost all the big hospitals like Karolinska or other hospitals, they have an innovation officer. It's very rare here in India that you go to a hospital and see an innovation officer. And we found that what is the innovation officer is supposed to do. So the best example we saw was in Uppsala. So what they do in Uppsala, all the year round they collect unmet needs. What is the unmet need of the patient? What is the unmet need of the nurse, doctor, whatever? And then they solve it. They give all these unmet needs to the university. University does a research project, they solve it, then the university gives it to the incubator. And then incubator is just looking for a random person who can actually take that research and build a company out of it. So they have built the world's third best incubator in Uppsala, just by this method of linking a hospital with the university with the incubator. So I think all the nurses of the future, with their understanding of unmet needs, they are totally aware of those needs, but we are not documenting. Imagine we provide a platform to them to document it. Imagine you organize a contest at all India level. What is the unmet need of a nurse? We qualify it, and if possible, they can propose a solution, they can patent it. Maybe you can propose a opportunity for them to patent it, right? And I think that's where you bring it to Triple IT, Jaspreet is sitting here, and we say, can you solve it? Maybe she will solve it, right? And that's how we can change the things. So I don't know if I answered, but maybe long answer, sorry for that.
Thank you. I agree with you. Probably down the lane of 5 years, we are talking about technology. See, even now the research is happening in nursing, and a very wide range researches are happening. This has to be published and made wide world available for public. The unmet needs, what you said, even that data is done in many of the super specialty hospitals, because if I ask Merlin, probably she's collecting that kind of data in a Fortis. Only thing is, the time is the thing what we are talking here is, as you said, when we avoid the too much of movement of a nurse, probably she can use that time for the data or the patient need. There's a lot of movement of a nurse. So we are looking forward that kind of technology which can save her time, and she can utilize this for the education of the patient or other healthcare outcome. And the same question will continue to Dr. Hara Prasad now. Like, you are working as a professional, you are taught many students. So what I feel at this point of time is, how do we prepare these healthcare professionals? How do we prepare this youth for this, taking up this challenge? Because it's a huge, technology huge, because from morning we are listening, there's no regulations as such right now in India. So we are talking about that. And we are not even sure that what will be the future of healthcare professionals with this technology. So what are those competencies, tools they have to equip at this point of time, if they have to face this technology when they are at the clinical side or anywhere where they are taking care of the patients?
So good afternoon to all. Good to see a young crowd. At least in the panelist, I think I am the youngest, but always good to share with experienced people. So first of all, I will start to comment, this is primarily a nursing session. So primarily when I finished my medical training, I also will appreciate the fact the maximum of my clinical training is from my senior nurses rather than my college professors. I will be frank on that part, especially my clinical training, not my theoretical. Because theoretical lectures are taken by medical doctors, but my clinical training more often, be it how I operate, my C-sections, everything, the hand-holding was happening with the nurses. So first of all, I appreciate that. Secondly, coming back to the fact that Kalra ma'am mentioned that doctors lack communication skills, psychology and psychiatry training, I also echo the same. But the fact remains is that since 2019, after coming of NMC, there has been revised curriculum, something called as CBME, Competency-Based Medical Education. So these factors have been taken into consideration and significant improvement has been brought in place. Though I am before that, my education is before that, but to just give you a hint, there is something called ATCOM, which talks about attitude, ethics and communication. So I'm focusing on this part because in the nursing training this has not been brought because they're doing well in that and doctors are performing very poorly in that part. So that's why new training has come up. And answering Lavanya ma'am's question, see, I personally believe that we need to classify the healthcare workers into two settings primarily if you want to train them in a bit. One is that kind of audience we are looking at, which is currently in colleges. It can be MBBS, nursing student or residents, something of that sort. And secondly, the kind of audience we're looking at who are out of the college setting, working professionals, right? Because what I personally feel, I interact a lot with medicos and also with nursing students. If you see, go to any college, they are very much, you can say, adaptive to the change and adaptive to technology. For example, recently I had a chat with a third year medico who is preparing for USMLE, and USMLE exam is for the US licensing exam. So that guy is facing a challenge to solve microbiology question. He's not good in that, but he has his exam. So what he did, he talked to me. I said, you can use ChatGPT. So he asked how. So I talked to him, and the next day he's telling me I have developed a custom GPT in which I am only fed up with microbiology PDF books, and I'm getting my answers. I'm trying to learn more about it in a very easier way, right? So this is one of the examples. I have enumerate a lot of examples on that part. Whereas whenever I go and meet senior professors, I talk about CDSS or something, I face eyebrows saying that how can you challenge my 40 years of experience, right? For example, just to give you a perspective, recently a patient came to us, and that patient had a adverse effect because I come from pharma background. So that adverse effect was something like reported in 1 in 10,000. So my professor and the senior colleagues were not hinting in the way that it is a drug reaction. But if you go by stats, it's a drug reaction. So sometimes AI will definitely come in place, but convincing the older generation is tough. I personally face it a lot. But yes, I'm not blaming anyone, but open to discussions on this part. And getting back to the competencies, like all the panelists mentioned, data knowledge is very important. What I echo is that all the nursing, medical people, if you go by their career decisions, though I'm not in that category, I opted for mathematics in my class 12th also. So most of them who opt out of mathematics join some kind of life science or medical science. That is in general, right? So that boils down on a latter scale that when you go and talk about AI or computer or tech, the first question comes, do I need to code? Do I need to understand the graphs? Do I need to understand the plots, right? That is the biggest challenge people start asking. And like yesterday, a lot of discussion happened around no code, low code policies, and a lot of DIY tools are coming up. So this is something that will be addressed. Answering it further, a lot of things are coming up and happening to improve on these competencies. I will give you a few examples. For example, we all can see in the ecosystem partner, there is something in the third logo after PHFI you can find, a small logo, blue in color, that is Delhi Science and Technology Cluster. So I was a part of that back in 2021, and I was mentored by Dr. Tav. This is one of those examples of science and technology cluster in which a lot of academic, medical, engineering institute came under one roof. So that was back in COVID days. But if you try to understand the problem all of the panelists raised, healthcare is actually functioning in silos. For example, sir talking about that a nursing person winning an app competition. In India, nobody's thinking about it because if you see, the healthcare people are working in their setup, the tech people are working in their setup, the communication is not happening that much. So I believe for umbrella, if that brings it, there will be more talking happening and more conversation that will improve the things.
I think convincing experienced people is difficult. I feel even convincing youth is also very difficult because I handle so many youth on day-to-day basis. See, to bring them to this conference, I took 1 hour to tell them why it is important. The reason is they are unable to relate because, see, I talk about AR, VR, MR, until I bring that into the reality that this is what is happening. They will not believe you. Youth will never believe without the research and the data. This is what I've experienced. Thank you for that. Let's go with a quick session because I have to take a questions. Merlin, as he said, that we need to prepare, youth in this way, the healthcare workers. Do you have such examples set in your hospital that someone has trained in technology? Do you have any career growth for them? Have you seen that they feel good to take up this because you are giving some monetary benefits? Because this is a way you can encourage and motivate people to take up technology into their career.
So talking about career opportunity, I think all of us are interested in this particular question as well. As ma'am was saying, yes, there is lots of very nice career opportunities coming up. In most of the hospitals, mostly in corporate sectors, there is a separate field called healthcare informatics itself. So in the organization where I work, we come under MSOG, Medical Strategy and Operations Group, in which there is a separate team called Medical IT, where there is a nursing group, the pharmacologist, and then doctors, and then even a normal admin person is also involved. So they are all involved in making this EMR implementation completely. So, but then they just didn't come just with their own background experience. They have done few courses which will help them to understand the basics of information technology, and then they are coming into this field. So yes, there is lots of opportunities, but people who are sitting here, if you are interested, please try to focus and broaden your view on healthcare. It's whatever we have seen since yesterday, mostly it's about diagnostics or mostly it's about robotics and everything. When I'm sitting here as a nursing personnel, I can tell you one example. Basic is nursing rostering. I think all of you know. In one hospital, for example, where I work, in one hospital there are 600 nurses who is working. And at least maximum of 50 nurse to minimum of 10 nurse in one particular ward. So the nursing in charge has to plan the rota of 50 nurses for 1 month, for which she'll spend at least 1 day sitting and calculating. So please bring up something where she can just, and it is all based on the years of experience, the competency of the nurse. For a night shift, she has to put 2 very good senior nurses and then 2 years experience and then 1 year experience. That's how she has to plan. But all these data are already uploaded in Oracle. If you bring some innovative ideas, she just have to put it and then give 1 click and all the rota is coming up. You're just making the life of a nurse very easy. So same way, patient acuity tool. Every day the in-charge nurse has to sit and plan which patient I have to assign to which nurse. Again, it goes on competency based. In a critical care area, patient on a ventilator who is very vulnerable, so she has to assign 1:1 and she has to assign the senior most nurse who is capable of handling all this, maybe an ECMO or an IABP, whatever the patient is on. Same thing applies there also. So if you bring up any tool where she just have to click and then even the patient assignment is done, you're making the nurse's life really happy. So we are not asking to bring machines, make the machines work on wheel, carton wheel, all of course this is all best of the best. But then please understand the workflow, the process, what we are going through. Maybe a one week of just walk through with us in our workflow, you'll be able to understand in which all process you can make changes. And I'm telling you, nurses are ready to accept the change because we are working for it. And about the data, what I have already told, with 1 click, if you bring the data, the quality indicators, we'll be able to take up the patient safety aspects. For example, hand hygiene compliance. We were using the WHO hand hygiene tool. The infection control nurse has to take the audit sheet, go everywhere, collect the data, bring it, compliance data, and then she has to compare with the hospital-acquired infections. Now there are data where she just have to stand with a mobile app, she just have to click it, and then for every day, every week, every month, we get the data just like that. And it is very easy to correlate with the hospital infection which is happening in that particular areas. So these are the best possible things. So if you are all interested in all these things, please bring up solutions for all these things which will make the healthcare professionals their life easy, and you will have the best opportunities in the healthcare as well.
Thank you. And Merlin, yes, we agree with you that there may be a future scientists sitting over here, probably in healthcare, probably in IIT, probably in any sector as such we are talking. Like what we see in nursing is we have a super specialized subjects right now in all these specialties. I think after a few years we'll see a super specialization even in technological nurse. Like we can say artificial intelligence was not addressed 5 years before. Any student engineering going, they used to say computer science. But later on, it came up like, I will take AI. So that can come up to other streams as well, even in healthcare, probably for the doctors. There may be a subject introduced in specialized as AI or any technological advancement. Thank you for that, Merlin. Ma'am Kalra, as she was saying that they are very easy to accept, nurses or healthcare workers, they easily accept the changes. Do you agree with this? And in case, if there's anything they have to integrate, because it's not easy to accept a change so easily, because something it is, as I said, it is unknown to many of us. Many of the healthcare workers are not really knowing how this is working. If there's any, is it easy to accept? And if there's any challenges, how do they overcome? Can you give them suggestions?
Thank you so much. And as you said, is it easy to accept the change? Change is always difficult to accept. But if you are prepared to accept the change, like we say, it is something like it is freezed. You need to unfreeze it. You need to make it that you prepare the person, involve the person in bringing the change. Like Merlin said, that one has to understand what is our need. If you bring something which is going to make my life easier, if you bring in something which I have identified as my need, it becomes more easy for me to embrace. I will not agree that people who are professor level and, who are grown up are not embracing the change. I think we are bringing a lot of change. I think maybe I'm the one who's eldest among all, sitting over here. I can see, I can tell that with my experience also, many times youth people, you need to tell that I have done it, I can do it, so you can also do it. Youngsters, we need to motivate it. And definitely, if it is something which is, we need to make people understand how things are going to make our life easy. How it is that, like if suppose we talk about nowadays, there are a lot of in nursing education also, with NAC coming up and going into outcome-based education and calculating about how much you have achieved your course objectives, program objectives and all. We have app available. Fine. We are ourselves getting trained. Fine. And we are ready to embrace the change because we feel that things are going to become easier. As a person from education background, I can say that we have people available who say that to give us, and now earlier teacher had to sit long time to make the objective type questions. With AI, it is very easy. Now with your mobile app, you can just, on a click, you can submit your attendance. You don't have to write in the register. You're going to save page. Fine, you're going to save a lot of pages and the paper will be saved. You can correct then and there when you have given the questions, your test. So it is up to us that how, if we are able to say what is the need, people, if they understand this is our need and we are able to work closely with the people who are bringing in the changes, who are bringing the apps, who are bringing the digi-technology, the things are going to become much, much easier. But at the same time, one thing that we have to always remember is when we talk about digi-health, till now what is missing is the patient are most important. Our healthcare is based on the needs of the patient. It is not only as healthcare professional what we feel, we also need to ask the patients, ask general people, what is their need. And when we have some app coming up, something coming up, how they are satisfied or what are the difficulties which they are facing, not only the healthcare professionals, even the common general man, what are the difficulties they are facing, that also needs to be looked into. There are wearable apps which are, we have a lot of things that I can put my smartwatch and I will know my pulse and I can get my ECG and so many other things. Fine? But maybe there are some problems they are facing. So somewhere the feedback from the consumer also need to be taken up. It can never be, I'll just repeat, that yes, it is there. Any change which is going to bring our life easier, much advanced things will be more easily accepted. We need to embrace the change and we are all prepared to have those changes coming in our life. Thank you so much.
It's all about mindset, which matters at the end of the day. Thank you for that. Mr. Sachin, now you said data is so important for the healthcare professionals. Even now, manually, we collect a lot of data, and we see there's a leakage of data. Privacy is something which has to be really taken care. When it comes through the technology, it's even more, you have to be careful maintaining this data privacy, security of the patient data. So can you give a little, tips for these youngsters? Because they take, they are the one who may be taking a lot of data of the patients at the bedside, collecting it, and they have to save it without, seeing that it is misused by someone else. So we want you to address on this.
Thank you, ma'am. It so happens my training is in cybersecurity. I've studied cryptography. And Dr. Vijay Agarwal was here yesterday, so he manages KAHO, which you may be aware of. So I've organized trainings many times for hospitals. And I don't think I have ever come across any hospital in India that I can say is secure. Our approach to security is a reactionary approach. I remember, I don't want to name, but it is the largest diagnostic lab of this country, which is publicly listed. 2 years ago, they had a security breach. All the data was taken away. And then they made a job opening of chief security officer after that incident. So people only want to spend money on security when it happens. Nobody is willing to take a proactive approach. I think I spend most of my time educating through KAHO. Is first thing a hospital should do is to create a cybersecurity policy. Because even if we don't want to take any step, is there a policy document which says that you should have a 8-character long password or a 10-character long password? You should change your password every month. I don't think those kind of documents are existing at first place. So it's like building a sanity check. So through you and your influence, I think we should, it will not take more than an hour. If we just ask people to brainstorm, can you document 5 or 10 things that you could print out and put somewhere, that this is a sanity list, right? I think that could be a starting point, because I don't want to take a lot of time today because maybe it's not the right forum. But I think security is a mindset. You can bring all the kind of tools and technology, they will not be able to save you if you don't have the mindset for it. So maybe I will stop here. Thank you.
I think we should have a separate session for this. It's a very broad subject. Dr. Hara Prasad, as Madam Kalra was saying, that the change always comes with a resistance. Like now, if you have to handle a group of healthcare professionals, like we need to prepare them for these challenges and technological advances. So how do we go about this as an organization? Because I feel the leadership also matters here in any organization.
So before answering, all of you ragged me for the fact that seniors are not well adapters. I'm not in favor of that. I'm just trying to say it's very difficult to convince. That's the only thing. But yes, you all are the road shows. I admire a lot the KFC founder for that same fact. Getting back, ma'am, like you mentioned, it's very tough to handle organizational level things. So I will share my own experience. In 2022, I worked for a company called DOSI, which Upashna ma'am mentioned yesterday. So to give you a brief perspective, DOSI is into remote health monitoring. So they have something, a small, a mobile-like device, and they will have a small mat. They will put it below the mattress, and they will have some third-party integration. All the vitals will be on your app, something of that sort. So it is a 2015-16 founded company, but it spiked during the COVID times. To just give you a perspective, during COVID they were more into critical care. So I was hired as a consultant, and I was asked that draw a roadmap for cardiac care portfolio, how we should pivot to cardiac care. So I worked for them for a good amount of time. I visited multiple hospitals, starting from trust hospital to big corporates and government setup. To answer your question, the first question I faced was from the big doctors, because they're the superintendent, why we need to get it done. But believe me, the least resistance I faced was from the actual nurses who are working in the wards. Because the moment I made them explain that what exactly this device will do, they realized that it will significantly decrease the man hours and I can really focus on the things that matter. For example, a nurse of say 20 years of experience and the difference between a nurse with 5 years of experience is not getting into place if 4 hours of their time is getting into vital charting and all that, right? They can more focus on the empathy things and explaining a lot of stuff. So what I feel is that it's more on the communication part, like the concerned person who will be trying to convince, it will be a lot dependent on their skill set and giving the right example to the right kind of people so that they can balance the things. For example, like if somebody has lived in Uttar Pradesh, I can't quote an example from Kerala. That person will never relate, right? So I think that is the way forward. And to add on to it, I feel that we all have to be understanding the fact that things are changing very rapidly, so we need to be pluripotent in nature. Last time I was speaking as a speaker in a medical ethics in the same platform in 2022, and I will repeat the same thing that healthcare workers are the most agile people in terms of profession if you talk about, because like you study something and randomly you land up at a case which you are not that much mentally prepared of and you don't have the time. At least as a tech person, I can take my time. But as a healthcare worker, a lot of time it's an emergency condition, so we have to be pluripotent. And on the top of that, the only thing that is certain is uncertain. So we had ChatGPT last year, now we had Gemini, and yesterday we had Kritrim AI coming up. So change is the only constant, so we should adapt.
Thank you so much. Wonderful. We are a versatile speakers, not from one industry, 4 industry here. So with this, I would like to take a questions from the audience. There are experts here. I recommend you to ask questions to them and clarify your doubts and anything for future. You are free to, not only questions, even your suggestions are open for this forum. So any questions, please? Oh, lot of questions.
Good afternoon, dignitaries. My question to you all is, like, as a nurse, we have a very broad role. So I want to ask, like, what is the major difference if we involve AI plus medical coders? I want to know their role. If a nurse is a medical coder and if she is involved in AI, so what the major difference would bring? Because both are a new perspective in this nursing, which we don't have earlier.
Specific to medical coder, I don't have an answer. But as a nurse, if you really want to come into healthcare informatics, as I mentioned, there are 2 nurses who have come up. They were both, one was masters in nursing. After finishing masters, she has moved into healthcare informatics. The other one is an ICU nurse. So they both were hired into medical IT, and they were given a basic training of, they were involved in projects initially, and they are also taken up courses from IIT Delhi on projects in informatics, information technology. So after completing this course, they are completely involved in EMR implementation. So basically they are nurses, so they can tell the vendors what they want, how you are supposed to make the applications, because they always comes with some suggestion. They have a ready-made product with them, they say just implement it. But being an end user, you know where my nurse will get stuck and what is my understanding of this particular application, what you are giving it to me. So they are in a very important position of bridging both the vendors and the end users. So as a nurse, I'm not talking only about nurse, even the pharmacologist, anybody who is in that field, they'll be able to give suggestions to the vendors for making this application and trying a pilot, and then during the implementation process as well. For example, being a nurse, I know about the application completely, and I go teach my nurses, saying that this is how you have to use it. The nurse will be able to understand, or she will be able to ask questions to me and learn it from my side. Rather than an IT person coming and teaching to a nurse, he'll just talk Greek and Latin, and nurse will be like, she's a very small young nurse. She'll be like, okay sir, I understood everything, and she'll say thank you and leave. Ultimately, the information has not reached that particular nurse. So to bridge all these gaps, we need who is actually aspiring and interested in information technology. Those people do some basic of courses in information technology, so that you can be a part of this team where you can bridge the gap between the application or the innovators who is building the application and the end users. I think I answered.
I think to make it more easy for you to understand, it's a specialized advanced role. Like we never in the hospital earlier had infection control nurse. Now we have infection control nurses. They're the ones now who are even teaching each and every person who's getting into the hospital, even the doctors are being trained by the infection control nurse. So they are the ones who are able to understand from the nursing perspective what is the need and pass on and even train the nurses on that.
Probably for your question, as we said, like space nurse, we say industrial nurse, there may be IT nurse. That curriculum has not yet come up, but the way it is advancing the technology, in next few years, we may see in curriculum. As I said, it's not inculcated in our curriculum. Probably in next few years, it may be included in our curriculum, so we can look forward that, and we should get ready for that, to take up that curriculum without any hassles. Yeah, I think someone else was asking.
As an educator, I'm expecting after a few years we can conduct the OSCE with the help of AI. That will be a great help for our teachers to manage.
Yes. It's a very relevant thing because now in India the OSCE is something,
according
every
to-
institution,
Yeah.
this will be really helpful if it
A
is to
new
like-
curriculum it is indeed.
Thank you. Hi, I'm Manini Puranik. I have a question for Merlin. Merlin, you gave really nice operational examples of how tech could change how nurses operate. I'm speaking from the perspective of a patient because both my parents, I've been a primary caregiver, so spent a lot of time in hospitals. So the only friends I made were nurses. And one of the things that would come time and again, because, coming from a tech background, like Sachin mentioned, data collection. They are the first point of data collection. But the processes are very archaic. You go every day in the morning, 5 o'clock, they'll come with all their devices, take all those readings, probably carry a huge file, with so many pages, maybe fill it somewhat and go back to their desk and fill the rest. There's a lot of information lost in between. So what I started doing was, and I was in one of the big hospitals. I spent some 3.5 months with my father there, like day in and day out. And my job as a primary caregiver, I had only one patient to take care of, right? Unlike the nurses who were very, very overworked. And I think that's the case with big hospitals, that the nurses want to do good, but they're so overworked, patient to nurse ratio is really bad. And there, the data gets even worse. So a lot of information would get lost. So what I started doing is, I would just record it on WhatsApp. I would have the time. This was the way. So I would keep asking them, tell me what is this, tell me what is this. I knew nothing, okay? But I would record everything. But very soon I started realizing, in a very simple interface, even if the nurse does not carry the file, if you don't have to have complex EMR interfaces or whatever, just on their phone, every nurse is carrying a phone in her lab coat, right? She can take out the phone, there could be some name of the patient or the room number, like the file, click there and just enter, wait, this. It's recorded just in time. And I would ask them, why don't you just put it on WhatsApp? No, we have to follow the process. We have to go and write it over there. And this data would be in manual files on paper. And then once I also asked the matron, I was like, what do you do with this data? And she's like, nothing, we archive the files once, they get filled. I was like, wow, you're sitting on a mine of data. And you just, so do you think nurses would be open to some solutions in that respect? Because it's a very simple solution that can be deployed, which will help you also and help your teams to analyze data in the long run.
Thank you. This documentation part, what you're saying, this is not only you, even nurses ask question to us, and the whole doctors, the whole hospital, everybody asks question to us that, why are you documenting so much? Please remove our documents. This is the usual term we hear every time. But to be very frank, this is the only thing which will save us. It is basically the document. If you are doing something, it is documented. If it is not documented, it is clearly said that it is not done. So it is a phrase we teach nurses. So we insist them to document each and every happenings of that particular patient, because we are handling human beings, and for any legal aspects, which is when it goes more than the doctor's documentation or any other documentation, nursing documentation plays a very important role, because we document time in, and it's just minutes. I turn the patient left, and after 2 hours, if you see, my documentation will be I turn the patient right. So this is the minute details we capture. And this is helping us, and for all the accreditation process, this matters. For example, even for pain, I monitor pain for a patient at 8 o'clock, and the patient says the pain score is 6. I have to write documentation saying that at 8:10, I call this doctor, and he told to administer this particular drug. So 8:30, the drug is administered. After 2 hours, I have to reassess, and reassess pain score, I have to document. So this actually closes all the loop, and if you take any accreditation of NABH, JCI, anything, this is one of the process which they see. Not only for documentation and accreditation, it is actually closure of the care what we provide. So when you do a care, you are supposed to document, and we have to make sure that this is happening. Of course, it is a very tremendous job which we are doing. That's what I'm asking. Please make some solutions and give it to us to make our lives easy. And for example, as you said, there is one audit which, for example, what I have done, there is an audit process called nursing operating system to monitor how well we are able to give care. It is on 5 different aspects we have done. There were nearly 184 line items which a nurse has to go and audit on particular nurse who is doing. So what we can, from my exposure, what I can do is we removed 184 to 100 line items. That's the best possible thing I can do. And all these things have become in OneDrive, where we can all access from one point, which has made our life little easy. But of course, it is still an hectic, Herculean task only. But if you bring up any solutions which will make our lives easy, we are always ready to embrace a change. Please bring it to us. Ma'am has a point.
Just one thing, see, I'll tell you one thing, documentation is so important. That reminds me of one incident where I was attending one, medical legal case. There was a discussion, and the case was referred from court to Delhi Nursing Council. And they said that during COVID, the family lost the patient, and they said the care was not given. So it is those documents which were brought, and with the nurse's documentation, they could prove that the care was given. They said the person never attended, but it was recorded. They have gone this much time, at this time, and this is the time they called the doctor, the patient was shifted to ICU. So it is through documentation. For medical legal purposes, it is very important. But yes, over the period of time, maybe if we have things becoming much cheaper, we can have it at the bedside only, keeping the cyber security there, that the data doesn't get leaked, because that's very important. You have to maintain the privacy of the patient, and you also need to look into if it can be at the bedside, it will definitely save a lot of time. Thank you.
My point is not to do away with documentation, ever. Of course, that's not able. But if you look at finance and manufacturing, all their documentation, it's digital. So I was talking about just in time, because I'll give you an example. Just recently, my mother's in the hospital. The wait is to be recorded for CKD patients, right? One day, the nurse was a night nurse, right? So she noted the morning wait, and she noted it wrong. I remember with one patient. So I noted in my WhatsApp. I have a WhatsApp group with my sister on my mother's vitals. And they missed it by 2 kgs. So it was 64.2, it was written 66.2, because, the nurse had to go back and write it, and a very good nurse, I really am fond of her. And next day the doctor comes and he's like, ma'am, you're not losing weight. I'm like, of course she lost weight, she lost 2 kgs, 2.5 liters of urine output. So what I'm saying is, never lose the documentation. Of course, you need it in finance, manufacturing, everywhere, legal compliances. I'm saying just in time over there, so that the nurse does not miss the numbers, while going back, and she's human. Of course she'll miss it, right? And the second thing is just in time and in the most simple user interface. Your EMR systems, like I've seen in hospitals, are horrendous. As a techie, I would not use that system. You have to click here and then this will open and then that report will open. So something simpler. So my question is, are you open to those kind of solutions in nursing where you can go digital with your documentation? Yeah? Okay.
Just one thing, nobody remembers how many goals a goalkeeper saves, right? Everybody remembers how many goals are scored. So as a doctor, I will say, anytime I feel like nurse missed a dose to be given like a IV drug, I will ask the nurse, not the patient, right? So nurses are doing a fair job. It's only that the process needs to be simplified. Point well taken.
Ma'am, regarding adding the point of documentation, where I have studied my post-graduation, I have seen a device that is an electronic scanning pen, which whenever I was documenting with that pen, that automatically leads my written data to a system, and that's automatically saving the data into an electronic devices. Usually that pen is a kind of expensive, which was a drawback, which was not allowed to use by all IPD nurses, but the OPD nurses and the OPD doctors were using that pen, and it is already scanning all the documents of the day 1 to day end till the patient is visiting our hospital. So the device is already there.
Thank you for that. I think time is up now for this panel discussion. With this note, we thank all the panelists here. It was really a very good discussion, but it is not the end of the discussion, because I know there are a lot more things have not been closed right now, because as the subject itself is not a closed subject. So let's keep on having an interaction with the each industries over here, and probably we may get some conclusion over a period of time. And there's nothing to end up with the innovations and technology here. And thankful to all the audience for listening to us so carefully and putting up the questions. And I'm thankful to you. You have really opened up a good question here. This is something every head of the hospital has to think of this, because many of the human resource, we are losing it because of the documentation. As Merlin said, it's very, very tedious, but it is very, very imperative for the healthcare. Yeah, simplify. Thank you so much, and thank you all of you. Okay. That's your incredible work, I must say. Wow. Beautiful. Very nice. Yeah, it makes a sense. Please send us a copy of this. Thank you. Yeah.
As we bring close to this session, thank you, the panelists, for this interactive and informative session. I would request Professor Lavanya Nandan to felicitate our panelists. We start with the... Let's have a photo session first. Let's have a photo session first. Professor Lavanya, I request you to offer a token of appreciation to Dr. Raminder Kalra for being present here. Please put your hands together for our panelists. Next, we have Dr. Hara Prasad Mishra. Please put your hands together for all our panelists. It's been such an interesting, interactive, and engaging session. They all deserve a huge round of applause. Please put your hands together for all our panelists. Next, Ms. Merlin Gayathri. Please put your hands together for her. And lastly, Mr. Sachin Gaur. Thank you, sir. Thank you, ma'am. It was a great session. Please have your seats. Lavanya, ma'am, if you could please just wait here. I request Professor Jaspreet Kaur, IIIT Delhi, to come forward and felicitate Professor Lavanya Nandan. Thank you, Professor Nandan. Thank you, Professor Kaur. Yes, of course, ma'am.
Just for the nursing students and the nursing faculty over here, we would like to tell you InnoHEALTH has come up with a nursing forum. And we are in 4 states right now, in Uttar Pradesh, in Delhi, Uttarakhand, and one more state is, anyway. So now the participants who are here, the InnoHEALTH founder, VK Singh sir, has promised to give you a complimentary, membership, because you are attending this, such a wonderful session and the conference. He has promised to give you a membership, and please take this message to many more nurses. And I request all the panelists over here also take it to your hospitals and see that the nurses become the member of this forum, because this is not unlike any other nursing forums. There are so many other industrial people who can really contribute for the nursing profession, which we have seen it from yesterday. So with this note, I thank InnoHEALTH and also VK Singh and Mr. Sachin for this wonderful opportunity. Thank you so much.